Ivermectin, a drug best known for treating worms in horses and cows, is in the middle of a controversial debate over COVID-19 care.
Ivermectin is not a recommended treatment for COVID-19. It is not a recommended drug to prevent COVID-19.
The U.S. Surgeon General warns against it, but a Norfolk doctor who treats critical patients at Sentara Norfolk General and teaches students at EVMS received national attention for treating sepsis and founded a coalition of doctors who share COVID treatment advice, says the data he's reviewed proves ivermectin designed for humans can put a dent in the pandemic. He shared his beliefs in a YouTube video viewed more than 200,000 times.
It's exceedingly cheap, it's safe. Give it to everybody. That way we'll eliminate SARS-CoV-2. Will be gone.
A disclaimer on that video says it's for educational purposes and not intended to provide medical advice.
In the research that you've looked at, in the research that is out there, does it support that type of treatment plan?
Dr. David Boulware is an infectious disease expert guiding a major study about ivermectin funded by the National Institutes of Health.
There's a lot of passion about this. But the thing we need most is really data.
The World Health Organization, Food and Drug Administration, the Centers for Disease Control, and the National Institutes of Health all say there is not enough data from rigorous trials to prove ivermectin does more good than harm.
From a guideline perspective, you can't recommend something that really has no evidence or has really bad evidence or just weak evidence.
So how did a deworming drug even enter the COVID-19 critical care conversation? The buzz began with this study from June of 2020. It said ivermectin, a drug considered safe and approved by the FDA to treat parasitic infections in humans, stopped COVID in its tracks inside a lab. But the study's authors said ivermectin warrants further investigation for possible benefits in humans. Another study of 280 Florida COVID patients found ivermectin was associated with lower mortality during treatment of COVID-19. And again, the study's authors warned randomized controlled trials are needed to confirm these findings.
There is a drug that is proving to be of miraculous impact.
This explosive December 2020 testimony during a Senate hearing from Dr. Pierre Kory, who co-founded the Frontline COVID-19 Critical Care Alliance with Dr. Merrick, ignited even more interest in ivermectin. YouTube removed what you're about to hear, labeling it misinformation. We found this recording of the testimony on the U.S. Senate Committee on Homeland Security and Government Affairs website.
Mountains of data have emerged from many centers and countries around the world showing the miraculous effectiveness of ivermectin.
A few months later, in February 2021, the National Institutes of Health said data from trials with favorable information about ivermectin were small, administered various doses of the drug, and patients were often on other medications along with ivermectin. Dr. Anthony Fauci fired off this warning, too.
Don't do it. There's no evidence whatsoever that works, and it could potentially have toxicity.
Even with the word of caution, faith in ivermectin fueled a 24-fold increase in prescriptions for the drug since the pandemic began, reaching more than 88,000 prescriptions by mid-August, according to the CDC. And others are taking matters into their own hands, easily getting ivermectin meant for large animals over the counter or online and self-dosing.
The dosing for a person who might weigh 150 pounds is very different than the dosing that might be given to a horse or a cow who, can weigh upwards of 1,000 pounds.
And people are getting sick from that ivermectin meant for animals, suffering from hallucinations and tremors. Poison control centers across the country are reporting a threefold increase in calls about ivermectin.
So, Your Honor, we are asking...
The COVID care fight is making its way to courtrooms across the country. The wife of a hospitalized and intubated COVID patient in Ohio sued the hospital because they would not treat him with ivermectin. The judge ruled in the wife's favor, but days later reversed that decision. News 3 Investigates tracked down the ivermectin policies at our local hospitals and urgent care centers. Riverside Regional does allow their doctors to treat COVID patients with ivermectin. So does Patient First. Bon Secours only pointed us to FDA and NIH guidance not to prescribe it. Chesapeake Regional declined to comment. It's a no-go at Velocity Urgent Care. CHKD says we do not recommend it and do not prescribe it. And Sentara Norfolk General, where Dr. Merrick treats critical patients, they don't allow him or any doctors in their Sentara network to treat COVID patients with ivermectin. Now, we reached out to Dr. Merrick about this several times, but we never heard anything back. We did, however, find this widely viewed video online of Dr. Merrick questioning public health agencies for their stance on ivermectin.
And hopefully the WHO, the CDC, the NIH will listen to us. You know, they can only be deaf and dumb for so many months.
Merrick and his partners at the Frontline COVID-19 Critical Care Alliance wrote a paper analyzing the data from trials favorable to ivermectin use. But Frontiers Medical Journal pulled the paper, saying the article made a series of strong, unsupported claims based on studies with insufficient statistical significance and, at times, without the use of control groups.
The gold standard is sort of a randomized, double-blind, placebo-controlled trials.
In August of this year, the initial findings of the Together trial with all those rigorous standards was shared with the NIH. Dr. Boulware says it casts doubt on ivermectin as a COVID treatment.
Over 700 people where it didn't have any benefit over placebo kind of puts a little bit of a question mark in my mind.
Boulware is advising another randomized, double-blind, placebo-controlled trial underway right now. He hopes the data will add evidence to the ivermectin debate.
If ivermectin is highly effective, then everyone should be using it. And at the same time, if it's really proven not to be effective or not have any benefit, then people should not be using it and they should really move on to something else.